Good morning, and welcome to this i3 Health interview. Today we have an interview from the 2025 Alliance Annual Conference, and I have the pleasure of being joined by Shelby Englert and Lori Agbonkhese from the American Urological Association, where Shelby is the Vice President of Education and Lori is the Director of International Programs. At Alliance, they presented a session on developing global education, and today they're here to share some additional insights into this topic. Shelby and Lori, great to have you both on the show today. To start off, would you like to introduce yourselves and share a little bit about what you do at AUA?
Hi, thank you for having us. Yes, my name's Shelby Englert, and I've been with the AUA for 9 years, and I have oversight to both domestic and global education, as well as clinical research and leadership business. And so we have created this great opportunity around global education around the expertise of Lori. So I will pass it over for Lori's introduction.
Great. Thank you, Shelby. And I'm Lori Agbonkhese. I'm the Director of International Programs at the AUA, and I've been with the organization about 23 years now, so I'm a long timer. I'm primarily responsible for AUA's global outreach and our diplomacy, building those relationships that help us bring education into the countries that we're looking to partner with. So I work very closely with Shelby and am mostly responsible for our global education outside of the United States and Canada.
Amazing. Looking forward to hearing more of your expertise today. So to start off, for a little bit of background, what are some of the different variables that are involved in healthcare education for domestic versus international audiences?
Yeah, the one thing that we talk about a lot is not assuming that the global audience is the same as your domestic. The whole um, track of their medical education is different. So, you want to make sure that you're understanding the residency experience. So we have ACGME, that's the group that manages our resident and fellowships, but that's not the case internationally. Now, ACGME has gone international, but you can assume that those groups may be closer to our structure, but obviously variable, but then everyone else does not. So you have to not assume that the resident experience is the same. And then you can't assume that the licensing is the same. The US has a 3-year expectation of training before you can get licensed, but other groups have other amounts of time. So depending on the area of interest, you just need to know that a little bit. Um, and then also the expectation of relicensure. We live in an environment where we do relicensure, and that is very much tied to CME credit. And so other groups may not do that, and therefore offering accredited education for the credit may not be as valuable to your global audience. So once you can understand that it's not apples to apples when you have two physicians in the room with you, then you have to take in consideration their practice environment. So you have practice differences as far as even treatment opportunities, but you have cultural differences. So how they learn, the environmental differences just in general. So there's lots of elements that are very different. And so for anyone going into this space, we strongly recommend you do your due diligence and do your research and make sure that you understand the physician's point of view in country A versus country B, and not assume that domestic US is the same worldwide.
Great. Thanks for the overview. Definitely a lot of things to keep in mind there. So I know one of the things you talked about in your presentation was the idea of an international educational needs assessment. Would you like to tell us a little bit about what this is, what it should include, and then how medical education planners can go about conducting one?
Absolutely. So, as a medical specialty society, we are fortunate that about half of our members are international. So, we already have a built in group that we can research with. So, what we do is through our annual meeting and through other modalities, we will work with our international membership. And so, our process is we will do one-on-one interviews and really try to get to some identification of their overarching needs. And then we'll have focus groups primarily at our annual meeting, but we can also do those virtually. Based on all of that feedback, we'll do an online survey tool that will go out to our large international membership. We collect all of that data. Now, a lot of the times when we do it, we will also be doing a side-by-side domestic survey. So our domestic audience and our international audience will be asked the exact same questions because we want to see that comparison. So if we're talking about treatment adoption, region A versus region B, adoption of clinical guidelines. So, the primary thing that you need to consider is how are you going to reach that audience, as far as getting access to emails in our case. So you need to think about that. And then you need to think about developing a tool that has overarching, you want just to collect information, but you want to talk about their competencies and their comfort levels, and then actual knowledge-based information, because someone may say they are very confident and very competent, but then you have them answer actual questions and they are not successful in answering the questions. So it's a lengthy survey for sure, but once we get the outcomes, we will literally do infographics that compare domestic versus global, so that when Lori goes to develop the content, she will know where she needs to realign learning objectives or content.
Great. No, that's great to have that side-by-side comparison so that you kind of have an idea of the considerations to go into it. And I'm sure it's something that's constantly evolving too as you get more feedback from learners, new considerations come into play. I'm sure it's definitely something that.
Absolutely.
Yep. Great. So moving on a little bit to faculty selection and different types of activities, the activity modalities. What are some of the considerations that should be taken to go into these things?
Sure, I can take that one. So my recommendation would be to think of your faculty beyond just being a great speaker. So when you're selecting those faculty, they're really representing you as an extension of the organization and an ambassador. So that has long-term reach, and you can either have a good experience or a bad experience. So you want to look at faculty who are top KOLs, who know about international travel if you're doing it in person, have that flexibility and that open-mindedness that they want to experience the culture and network and make those connections with their counterparts wherever you might be going. So again, thinking them as ambassadors and not just an expert going in one time and then coming back out is how I like to approach things, because I always look at long-term sustainability of your activities. And then I would say in terms of modalities, looking at the different learner preferences and the formats. Are you doing something in person? Are you doing something virtually? When selecting faculty, if you're doing virtual, you want someone who has some experience in using whatever, interactive platform you're going to use as well. And if they're a good speaker in that modality, looking at, do you want it didactic versus interactive, or do the learners prefer more of a small group versus a large group? So those are all those considerations that you want to take into your planning activities and making sure that it's a great and a robust educational activity.
Awesome. Yeah, it's so interesting that the different cultures can have different preferences for certain types of activities. So it's really interesting to hear about. I know you also talked a little bit in your session about the importance of partnering with multinational and also country-specific medical societies. Like, do tell us a little bit more about how this can be done and the importance of it?
Yeah, certainly. So at AUA, we really don't go into a country unless we've established like that diplomatic relationship with them. So we want to be viewed as a complementer and a partner, as opposed to someone who is coming in and being seen as taking over or competing with that national society. So it's very important to have that established relationship so that you can be successful long term. So you also need to look at, if you're partnering with that national or multinational society, they might already have a built-in audience. So they have their members in country that you can tap into that existing audience to make your program more successful. And they can help you promote and just get the word out and implement that education on a wider range. And then I would say, in terms of, if you do go into a location where you don't really have that relationship, it could again be perceived as taking over, and you really want to look at long-term effort. And I would say that will set you up for future success.
Great to know.
Yep.
So now, in addition to partnering with different societies, it was partnering with industry as well. So what's the importance of collaborating with industry partners for global education?
Yeah, so I think I could take that one too. And Shelby, feel free to jump in as you'd like. I would say industry can be a really effective partner when you're doing your global education. So we utilize our educational needs assessment really as the foundation of building out our global education programs. And that can also expand, working with industry can also expand your offerings and your reach. So I think it's also another way that you can really stay abreast of those advancements that are in the pipeline. So partnering with industry, a lot of times your goals and their goals might align. And when that happens, it can be an effective partnership that you can expand the reach of the education. And then you can also find out as well, perhaps a particular country doesn't have access to a particular therapy or a device, and then you can tailor your education based upon those limitations that you might be facing as well.
Definitely. It's great to keep in mind too. So with all of this in mind, for companies that are considering taking the plunge into developing global education for the first time, how do you recommend they begin?
Yeah, I'll take that one. A strategic vision, a strategic plan, buy-in at the top of whatever organization, because as Lori's mentioned, you have to go in it with a long timeline for investment. So the AUA has invested a significant amount of resources into our global education footprint. It has taken Lori 15 20 years to establish the relationships and trust that she has around the world. And so your organization shouldn't see this as a short-term endeavor. Therefore, you have to have strategic goals. You have to have expectations that it will take multiple years to build up to maybe a solid ROI. I don't think people can just go in, plop down a course, put on a big registration fee, and think that they're going to walk out with a positive outcome. It is much more complicated than that. And so that, strategic vision and really understanding the investment, in my opinion, is crucial. Lori, would you add anything to that?
No, Shelby, I think you hit that. I think it's important to relay the multi-year commitment and understanding that from the beginning, because as Shelby said, you can't just take a program in. You need to look at it in terms of like a 3 to a 5 year plan, because that's going to develop the partnerships that you need to be successful long term.
Right.
Yeah,
Definitely a marathon, not a sprint.
absolutely.
Great. So as I wrap up today, my last question for both of you is, what would your biggest piece of advice or take-home message be about how to develop effective and inclusive global education?
So I'm going to start there because we've talked about your faculty and your needs assessment and your audience and your partners, but let's talk about your internal resources. Staff expertise is crucial. You can't take a meeting planner or a education manager who's used to doing domestic education and just assume that they have the ability to pivot internationally. So my biggest piece of advice is make sure you are staffed correctly on both. So Lori is our number one diplomat, essentially. And then we have education managers who support Lori. And we also have meeting planners who are used to going into that international environment. And so make sure that your organization not only has that strategic plan, but has those internal resources that are expertise in this area. And so, Lori, what are your thoughts?
Yeah, absolutely. Kind of to dovetail to that, we had already talked about the understanding that it's going to be a multi-year commitment, but also prioritizing where your efforts are going to be. So look, you can't be everything to everyone. So where are those partners or those countries that you want to partner with, and maybe approach it in a phased in approach. So phase one might be 2 or 3 countries, and then you just advance from there. Because once you roll that out, you just need to be prepared that you're going to get inquiries. Other societies are going to see that happening. So you have to have a plan in advance for how you're going to roll out your global education components. And then I would say recognize as well that your outcomes might take several years as well. determine what outcomes you're going to use to measure your success. Is it membership? Is it attendance at your annual meeting? Is it product sales? So identifying those in advance helps you have a consistent way to look at the measurements and the data that's coming back.
Amazing. Well, these are really great pieces of advice to share and messages to wrap up on. So thank you both so much for coming on today to share all of your insights and expertise with us. It was really wonderful to learn more about developing global education. I'm sure our audience will find it very useful as well. So thank you again.
Well, thank you for having us. We really appreciate the opportunity.
Yes, thank you.